I am Dr. Sharna Prasad, physical therapist, DPT, therapeutic pain specialist, diploma in lifestyle medicine, trained in acceptance and commitment therapy and self-compassion. I have a lived experience of persistent pain. Before I go any further, I would like to stress that the information that I share is for general education only. Please consult with your healthcare providers for specific concerns. Additionally, please watch the previous videos as these videos are in series. Today we're going to talk about acute versus chronic pain, understanding pain. Delete that one. Understanding pain, a journey from acute to chronic and beyond pain. It's sharp, sudden, and demands your attention. When we stab a toe or cut a finger, we instinctively recoil, clutching the wound, bracing against the sting. That is acute pain, a signal, a warning, a flare from the body designed to protect us. It typically lasts for less than 3 months, fading away as the injury heals. But what happens when pain lingers? When weeks turn into months and the aching refuses to subside? That is chronic pain, or I prefer calling it persistent pain, a different beast entirely. It persists beyond the expected healing time, stretching its grip for past the initial injury. The magic of 3 months. Why is 3 months the marker? Does something magical happen at the 12-week mark? Not magic, but science. Let's break it down. A fractured femur, one of the largest bones in the body, the bone that attaches from the hip to the knee, heals in 8 to 12 weeks. A moderate ankle sprain takes about 6 weeks to recover. A liver transplant, the organ regenerates within 6 to 12 weeks. Across different tissues, different injuries, and different organs, the body follows an incredible, predictable timeline. By the 3-month mark, healing is well underway, often complete. This is why the definition of pain shifts from acute to chronic at this point. It's not just an arbitrary medical rule. It's a deep reflection of human physiology. So, why am I still in pain? If your tissues have healed, yet pain remains, the logical question is why? Before we go any further, pause for a moment. If you've been told by a doctor nothing is wrong with you, take a deep breath. Let that sink in. Your body is not broken. Your tissues have healed, and yet your pain is real. This is a crucial turning point in understanding persistent pain. The weight of pain more than just the body. In my rural practice, I've seen pain steal livelihoods. I've seen hardworking people, farmers, laborers, parents, crippled not just by the sensation of pain, but by what it represents. Pain convinces them that their bodies are deteriorating, that every movement is causing more pain, that their future is one of inevitable decline. But when they realize, truly understand that their pain is absolutely real, yet no longer about tissue damage, something shifts. Their pain changes. This shift is everything. Why does pain persist? During an acute injury, nociceptors, danger detecting nerve endings, flood the brain with distress signal. The brain in turn assesses the threat and produces pain to protect you. But here's the catch. Pain is not just about the body. Your thoughts, your emotions, and the environment all influence your brain processes pain. All influences how your brain processes pain. If your brain believes you're still in danger, even after the tissues have healed, it will continue to generate pain. This is why even a simple movement like walking can hurt months later. Your brain, trying to protect you, keeps the alarm system on high alert. The power of association. How pain gets wired in. Have you ever heard an old song and instantly been transported back to a childhood memory? Maybe a Beatles tune reminds you of your grandmother's house, the laughter of cousins, the smell of home-cooked meals, the warmth of nostalgia. This happens because neurons that fire together wire together. The brain links the song to the memory, so hearing it brings back the entire experience. Now imagine this principle applied to movement and pain. If you have moved with pain for a long time, your movement neurons and the danger neurons start to wire together. The brain learns bending forward hurts, walking hurts, even thinking about movement hurts. Soon, the mere application of movement triggers pain. Before you even move, your brain isn't trying to betray you, it's trying to protect you. But in doing so, it creates an unhelpful pain prediction loop. My own story, breaking free from the fear of pain. I know this firsthand. When I experienced low back pain, I avoided bending forward. I quit yoga. I stopped lifting weights and lived in constant fear. Fear of making it worse. Fear of ending up in a wheelchair. Fear of losing control. For 2 years, I let fear dictate my life. Understanding the science of pain was the first step, but knowledge alone didn't heal me. What did? Gentle, intentional movement. I started small. I'd move just enough to feel discomfort, then stop. Breathe. Try again. I treated my pain with respect, not fear. Over time, my brain began to feel safe again. I returned to yoga. I started deadlifting. I reclaimed my body. Within 6 months, I was pain-free. Now, every pain experience is unique. Every recovery journey is different. But one thing remains true. You are not broken. You are in control. Trust yourself. Before we move forward, let me ask you, who knows your body best? The answer is you. You are the driver of this journey, not your doctor, not your therapist, not your coach, and not me for sure. If a movement increases your pain, adjust it. If it feels good, lean into it. Be kind to yourself. I once had a patient who said, if anyone speaks to me the way I speak to myself, I'd punch them in the face. Let that sink in. How do you speak to yourself about your pain? What is your narrative? What words do you use to describe your pain? Your healing is in your narrative. So here are some practical skills to rewire your pain. The first one is go to it, not through it. Choose a movement you fear. Example, bending forward or doing stairs or raising your arm to reach above your head. Whatever area is painful for you or you want to work on. Watch someone else do it, a loved one, a video. If watching someone else doesn't hurt, you're ready for the next step. Visualize yourself doing it. If even imagining that movement causes pain, reduce the range in your visualization. Attempt the movement slowly, paying close attention to the sensations, the thoughts, and emotion. Stop if it hurts. Breathe. Try again. Accept the thoughts, the emotions, and the sensations. And the last step, thank your brain for that experience. As your brain and your body is only trying to keep you safe. Work with a physical therapist, occupational therapist, or a pain coach to move safely if doing it by yourself is too challenging. Skill number 2, pendulation of the sensation. This technique teaches your body to observe and accept sensations without fear. Here, we pendulate between a neutral sensation and an uncomfortable sensation. The goal is to do this activity with kindness and curiosity and simple observation. Listen to a sound in the room. Birds outside, a clock ticking, etc. Stay with that for a couple of breaths. Say 5 to 6 breaths. Now, shift your focus to the uncomfortable area. Describe the physical sensations of that area. Throbbing, pulsing, hot, cold, sharp, dull, whatever it may be. Observe it. Using a coloring media in your visualization, color that area with the color of your choice. See how far you color it. How far do the borders go? Spend about 5 to 6 breaths in that space. Now return your focus back to the sounds in the room and listen to it for 5 to 6 breaths. And let's go back to that uncomfortable area that you were observing. Observe the physical sensations again. Pick a color to color that area just like you did before for 5 to 6 breaths. And then see if the color changed. Just observe. Bring your attention back to the sounds in the room for 5 to 6 breaths. And then you can open your eyes. Did the intensity change? Did the quality change? Did the sensations in that uncomfortable area increase? Or did it decrease? Or did it remain the same? Did the colors change? The thing we know about body sensations are they're always changing. Just like a song you hear, just like a memory, just like a taste of chocolate. You eat the chocolate and then the sensation is gone. The smell of roses, the touch of a cashmere shawl. Our body sensations alone are not pain. They're unpleasant sensation. It's a combination of the unpleasant sensations with the thoughts, emotions, environment, social factors, memories, etc. make it pain. Final thoughts. A new perspective on pain. Acute versus chronic. Tissue damage heals in 3 months. Persistent pain is a different story. Pain does not equal damage. Just because it hurts doesn't mean you're broken. Go to it, not through it. Gradual, safe movement is key. Pendulation. Train your body to observe pain without fear. Pain is real, it is valid, and most importantly, it can change. Let's take the first step together.